define mental health as a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stress of life, and is able to make a contribution to his or her community. Join Ambassador John Kamau, Tracy Kipto, and panelist Dr. Max Dati, Diane Kalei, and Dennis Maria as they dissect what, how, and when one can be defined as having mental health condition.
I studied at University of Adelaide. The main difference domestic students go through than international students is the financial relief that we get from the government. So most domestic students here don't pay their fees because of the HEX help and the Commonwealth sponsored. And while international students basically have to find their fees. And of course fees can either come from a lot of our students, especially the Kenyans, Nigerians who we usually bring here from overseas. They manage to fund their own program themselves by part-time work and so on. And of course that financial stress can be a very huge burden, especially if they can't get the financial relief from back home, which of course the past year has been the most challenging year for many students and many businesses, and we've seen a lot of people going really. The saying in Swahili, of course, is chini ya maji, because they don't come out and speak up, and basically they leave things till too late, which is something we're obviously not trying to encourage. Or we're encouraging everyone to speak up, encourage your peers to speak up so that they can come to us, and there's a whole heap of ways. Also there's we can also direct them, of course, to some of the government-funded agencies in Australia, Study Adelaide, Study Gold Coast, Study Perth, Study Brisbane, which are willing to listen to each and every student, and they're willing to help. And of course the universities themselves, especially in the past year, they've really worked hard and to make sure that they try and help students out in every single way possible, whether it's counseling or whether it's finding a way to find like some sort of financial relief, whether it's giving them scholarships. There's a whole heap of ways that universities have been trying to help students, but the main thing is always for the students to reach out to us first, because we don't actually know what you're really feeling, what you're thinking, what you're going through. So the main thing is always for students to reach out to us so that we can know exactly what you're going through and know exactly how to help if we can.
Thank you so much, Dennis, for that. And I hope everyone can actually speak up. We can only help you if you can tell us how to help you. In Australia, we have Judy, who will help us elaborate or know where we can actually find this help, who to talk to if you're here. They're normally a phone call away, a message away, and they're more than happy to listen to you. And Judy, would you please tell us how we can get you, what help or types of help we can get from you, or guidance? And yeah.
Thank you, Tracy, and I must start by actually thanking Flora for sharing her story, because I think there is no better experience than a lived experience. People are actually experts of their lives, and so when we listen to your story, Flora, we actually get from it a lot of things that reflect of the CAL community. The CAL community stands for the culturally and linguistically diverse communities. That means we are not mainstream Australian communities. And because of the many challenges that we have faced in the past, if you look at a story of a person who is not mainstream Australian, they have actually left their country to come and settle here. And they would have probably experienced a lot of challenges with that journey. Some of us have come here as skilled migrants, some of us have come here as students, some of us have come here as refugees. And so you can imagine that journey of leaving what you knew, and you left all that behind and come here and you're trying to assimilate. Obviously, we are actually exposed to mental health because there's a lot of things that come with a change in circumstance of people's lives. And mental health in Australia is actually classified as psychosocial disability, and it is funded as such because we all know and we've heard maybe of the National Disability Insurance Scheme, which is the biggest reform, social and reform in Australia, and that has supported people to actually live a better quality of life, even with what they are experiencing in their lives. The reason why there is a lot of a support for CAL communities is because we are known not to actually speak up. And even from today's discussions, we've heard how important it is to actually speak up, because people cannot know how you feel unless you tell them. And when you begin to speak up, then people begin to articulate what you're actually feeling and what you're struggling with. And when they start to articulate that, then you can receive the support that you need. Because then, once you get the support, then you can live a more normal life than you would have without the support. We have a lot of challenges of speaking up simply because of our culture and our background. We know that in many cultures, disability is frowned down upon. People don't talk about it because of the stigma that comes around it. But I think the moment we start to accept, then we start to move forward. And I think this is where now the speaking up and advocating is important for each and every one of us. Now the NDIS has rolled out a project to support people from CAL communities to access the NDIS better, because according to statistics, we are not accessing it as much as we should. We are not coming out to say we actually need to engage with the support. And if we are not doing that, then we are missing out. The doctor here has told us that early intervention is important. When you notice early enough and you get the support early enough, you're far better off than if you leave it for later. So there's various supports. Obviously, the NDIS, if you qualify, if you're eligible, you are in the right age group, you are an Australian citizen, or you hold a visa that is accepted, and you're actually living within Australia, then you can actually access NDIS and NDIS supports. If not, there's other supports in the community that are there and that they are available. One of the biggest one is being allocated a peer worker, or somebody who has actually suffered mental health, to walk with you in that journey and to actually make you feel like you're not alone. And that is a very big support system for a person suffering mental health, because then you have someone who shares their story and how they actually walked through to come out on the other side. Other supports are like informal supports within the community. Like now, we all know Aunt Flora's story when she says, look, hey, I'm not okay. We are here as a community to rally behind her. We know she has got children, she has got a husband. If she needs support, then we know that we can, whatever support we can provide as a community. And that is also an important, support system for her. Apart from that, there's also other supports that are known as continuity of supports. If you are not eligible for the NDIS, then you can actually probably get these supports for yourself. But the bottom line is, if you don't speak up, then you wouldn't know what supports you are eligible for. So the Multicultural Communities Council has been known for a long time to be a big advocate and a big empowering organization for people from CAL communities. So if you ever need anything and you contact them, they can actually connect you to NDIS and the partners in the community. So I think I can not reiterate more for us to actually start these conversations and talk about these issues, because we actually are exposed to it more than we think. Yeah, so thank you, John.
Thank you.
Well, thank you so much, Judy. When I spoke to you, you said that even people who are accessing the NDIS services, we rarely see Africans there,
yes.
People from the multicultural society. And thank you for coming here to explain that actually they can access these services. They can also be part of this scheme and can access help. Now, Unfortunately, today we are so many, so we are getting. Let's try to be brief now when we speak next. I'll come back to Dr. Latte. Now, in our community, the reason why, and part of the reason why the Baraza was formed is because of the issues that are in the community. There's so many issues in the community. Now, these people in the community, most of them do not get solutions within the local areas or within the community. They'll have maybe to go to Lifeline or ring other services, but within our community as an African and multicultural community, you come from Ghana and you have a Ghana community, but we have a Kenyan community as well. So how can we work together as a community? And people, we have a lot of experts, even from our Kenyan side. How can we help these people who are having issues in marriages, and these issues, they are culminating into mental health? Okay. If you can take us through that.
Okay. Well, I would say the communities, we can sort of collaborate as much as possible. I know quite a number of people in the Kenyan community, experts and doctors in the Kenyan community, and people who are counselors as well. In the African community, we seem to do things on our own as different communities, but we should be able to, at a certain level, sort of integrate so that we know the resources we have within the community. One thing I realized is that people from various cultural backgrounds find it difficult to access the health system as well. But one thing that I would say today is that we have a lot of expertise, and it just takes a phone call to get the right person to help you. So when it comes to help on the whole, if someone has concerns about their mental health, you can either speak to family or a trusted person, someone who will keep your issues as confidential as possible for you. Because I know some do not want to come out because they feel when they tell one person, everybody gets to know, and they get embarrassed. So you need to look out for someone who is trusted, who you can sort of tell your issues to. One such person would be a doctor, who is your GP, because a general practitioners are generally sort of the gateway into the health system. So I will encourage anyone in any of the communities to just approach any member who knows a doctor to start with, or a pastor or a counselor, and it just starts from there. We should be able to collaborate. It doesn't matter where you are, whether you are from the Kenyan community, Sudanese community, or Ghanaian community. In my practice, I do see quite a number of people from the Kenyan community, especially students with mental health issues. I do come across quite a number, and from the other communities as well. And if you listen to them, you just realize they feel alone. They feel very lonely, isolated. They don't feel like talking to anyone because they are afraid their issues will be aired among the community and they will feel embarrassed. And so the stigma is still there. But one person you can look out for would be a GP. The reason why a GP is one of the best people to look out for is you might have mental health issue, but you might have other issues as well. And seeing a GP is a good thing because general practitioners are able to sift through your issues. You know, you can be feeling tired, exhausted, not sleeping and all that. It may not be a mental health issue. It may be something else altogether. So I will encourage the communities to be able to identify key people in the communities that can sort of help people who are struggling. And the idea of opening up and destigmatizing mental health is essential, so that when someone says, I'm struggling, you don't say, what do you mean? I mean, toughen up. You don't do that. You just need to understand that the one truly has problems, because there are a lot of stresses that we come across. If I want to just list some of the things that are stresses, relationships can be a big one. You know, relationships, be it parent-child relationship, or husband-wife relationships, or friendships, or workplace issues, or even assignments. You are behind with assignments and you are so stressed, financial issues, trauma. People, most of us who come from other places, we have come from backgrounds, some come from traumatic backgrounds like war zones, and some have had abusive family life and all that. When you listen to their stories, you realize they have a baggage that they sort of come in with, and also on top of that, like what's the name again? Judy said, it's the person is displaced, so it's a whole adjustment issue for the one on top of all that. So I will encourage the communities or people to suss out their general practitioner. We are quite a number in the community, and it's a safe place you can open up and talk, and your issues will not go anywhere. And the bonus there is that your whole health will also be looked at. So I'll just take this opportunity to say that when you're going to see a doctor, it is important that everyone, things are not for free in Australia generally. So if you have Medicare, that makes it easy. But if you don't have Medicare, it's important that you have a health insurance. Yeah. All students and all migrants should have health insurance of a kind. If it's affordable, it is also good to add part of the insurance should cover counseling, because that is a big area where students or people who do not have Medicare or other health insurances struggle, because they cannot see a psychologist or a counselor because they will have to pay for it, and the finances are not there, they can't afford it. So I would say with the health insurance, it is good to have the extras if you can, and just suss out a doctor in the community, a general practitioner, and also make a phone call, make appointment, make a long appointment, because give the doctor enough time so you can talk. Arrive on time, the doctor will talk to you, listen to you, work through the issues, check whether this is a mental health issue or a physical health issue. The doctor will do a few tests just to delineate or differentiate between mental and physical health issues. The physical health issues are very easy to sort out. But if there are mental health issues, the doctor will talk to you a lot more about these. We want to know where you're coming from. We want to know how you were born, your position in the family dynamics, what happened in the family, whether there's abuse in the family, whether there's family health issues, whether there's alcohol abuse, whether there's drug abuse, whether there's sexual abuse, whether there is verbal abuse, where you went to school, whether you were bullied at school, whether school went well, whether you did well at school, or whether you were the bully. All those things formulate who you are. And when you are displaced, they sort of tend to come up. And also, we want to know that there's a family history of mental health issues. And so the questions will range from the time you were born right to where you are, and things that sort of stress you out. So on the whole, if it's a workplace issue, we look at were you bullied at work? Are you being bullied at work? Are you being displaced? Are you being discriminated against? So a GP is quite well placed to sort out a lot of issues. And if it's found out that you have a person has a mental health issue, what we do is if it's a simple, straightforward issue and finances are not a big problem, we direct you to the right person, like to Diane or someone who has a counseling background to counsel you. If it's a simple, straightforward issue, most GPs can do the counseling. But if we think it to be a protracted issue, then we need a team to help us to sort of look after the person. And it comes in the form of counseling, a bit of physical exercise. Worst case scenario, we end up sending the one to a psychiatrist. But to answer that question simply is to say the communities can easily collaborate because we know one another. And I know all the doctors in the Kenyan community, They know me, and we know the doctors in the Sudanese community and the Ugandan community. We are quite well linked. It's a matter of the leaders of these communities to sort of spread their wings and link up with us, and there's always help out there. In fact, I must say, to destigmatize things further, even doctors have their own doctors. You know, everybody needs help. There's no one who can be, above stress. We all go through it. You know, doctors have their own doctors, psychologists have their own psychologists. Doctors have their own psychologists. Some doctors have their own psychiatrists. So, simply put, you are not alone. You know, everyone can have problems, and it's a matter of just opening up and seeing the right person or being channeled into the right direction. And surely I've helped quite a number of students who have had a lot of adjustment issues. And it's a matter of the one being directed to the right place. And there is always help out there.
Thank you so much, Doctor. As you have heard, there is always help out there. There is always someone listening. And for the international students, if you're in university, there are so much help available. We have free counseling services. The universities will listen to you. They will probably ease some of your assignments if university or if the assignments is the problem or financial problem. They are there to listen to you. They're gonna direct you to the right path, and they're probably even gonna give you a leave. There is that leave that you can actually get if you're international student. They will give you like 6 months leave. You go, get yourself back up, and then come back. So never keep quiet. I'll say again, please talk to someone. Uni can be a very good place to go, and it's for free. And the next thing we'll do, we'll go to Diane, who will help us elaborate more on the help we can actually get from counselors.
I feel as though, Dr. Latte has said, it's very important to not only have Medicare or Medibank or health insurance, which will, I think, guide you on your journey to access anything in the health system. I feel like it's important to also understand how that, it can help. And I feel like it provides many doors and accesses to the health system and the things that you specifically are looking for or needing at the time. And I feel as though with accessing or having health insurance, it opens the right doors or gives you the options to have access to certain parts of the health system. I use it myself, and I feel as though, for instance, the health insurance that I'm with, I have downloaded the app, and most of them I think will have an app associated with it. And I feel like it's so much easier kind of, navigating through the health system through using their apps. It's normally pretty easy, and so I would definitely encourage those who have Medicare or who have health insurance to get the app. If you don't have health insurance, I would also encourage you to look into it and to go, to your local health insurance place, or even talk to your doctor or your GP. And I feel like they will guide you or direct you to certain health insurance places. And then I feel as though going from there, if you do decide to go with health insurance, definitely download the app. It'll definitely make your life a lot easier trying to not only even understand what you're eligible for, but even how to access it.
Yeah, thank you so much, Dan. And then coming back, we'll get Dennis to actually tell us about or what to expect when we come to Australia. This is in regard to international students, because they get a shock. This is a country they have never been there before, and then you land, you don't have families, you don't know where to ask for help, you don't know what to do next. You actually literally land and you know you are uni, where to get job, because one of the very first thing that comes in is the financial instability, especially when you have bills rolling. Maybe you didn't have your family already used all the stuff they had to actually bring you here, so they don't have that financial stability, and then you yourself here. this is not as homely as we would have thought. You don't meet friends in the bus and talk to. You literally have to kind of stay alone. So it's more you taken to somewhere you don't know anyone and no one is willing to talk to you unless you want to talk. And since it's your first day, you don't want to talk to. How or what helps do they come?
That's a good question, Tracy, actually. So what we do as an agency, one of the important things we do is pre-departure counseling. We try to let the students know what to expect, what to do, especially if you're coming to Adelaide. It's very important if you come to us on arrival. If you tell us, at least you come to our office so we can come to see, so we can get to see you. And also, we also do airport pickups as well. If the student wishes for us to do that, I strongly urge for the students, especially coming to Adelaide, we're happy to do airport pickups. I've done so many myself. So we go meet the student at the airport. And for those who are interstate, we're also willing to arrange someone else to handle that kind of business. But that's also an option that universities give each student before they make payment for their fees. So the financial hardship usually comes in after 6 or so months after you arrive, because when you pay for your initial payment, you're paying for your first semester or your first trimester, which is about 4 to 6 months. So that's important to note. But the other little things I'd like to also say is we're a big enough community at the moment. I'd say the students who really struggle the most are the ones who came in the early 2010s, when the community was much smaller and probably you could say much more fragmented. Well, right now we're a really good unit. The Kenyan community, the Ghanaian community, the Nigerian community. We have a lot. You could tell it's really big because and unified, because you have the galas, the sports events which we're organizing. So each student, as soon as they touch down, they should know that they've got someone to talk to. The number one person they should definitely reach out to is us, which we're willing to have a phone conversation. Help them get the little small things, such as we open the bank account before they get here, so that when they get here it's just a matter of walking into the bank and getting your bank card, or the means of transportation. Of course, transport here is quite, you could say it's relatively easy to learn, but it can be challenging for others. So the pre-departure counseling is very important, especially if they speak to one of our counselors, just to know exactly what they're going to face, what to expect. And as soon as they get here, it's very important for us to know that they're here safely. And because a lot of the people which we communicate with are the student families. Sometimes you get to know the family members more than the student, because of course in the African community the students are really driven by what their parents want them to do and so on. So it's very important to know that the pre-departure counseling is it's actually a free service. We're happy to help, just to get their feet up and running. That includes accommodation, where to stay, and the main thing is to know that each program, each university, each college that a student attends to, which we're partners with, we know other students who've been through that journey, so we can always link them up with them so that they can at least just smoothen up the journey and the starting process, especially when they come in.
Yep. Thank you so much for that. And we'll go to John.
Well, thank you so much, our viewers. Thank you, everyone that is watching. Well, from our Facebook friends here, I can see someone saying blessings to you all for all your contribution. I can see Geoffrey Baraka, who is part of the Baraza. He's saying, I suggest we create a community-specific Are You OK Day that can focus on our unique cultural response to mental issues. And then Hadassah Wanjawa, where we say, please recommend which ongoing support services are there for students impacted by mental health illness, domestic violence, and other issues. Now, I don't know who wants to go on this first, but before we go on to that, I would like Anne to tell us, when you came out, what are some of the stigma that you encountered? Was it that easy to come out? And as a community, as a baraza, how can we make this this issue of coming out to be not to become a stigma, and so that many other people can come out and get help? Okay. And like Hadassah is saying, they get support, ongoing support, especially international students. You talked about Medicare, Daktari, and also Diane. But for sure, when you're an international student, there are so many challenges in terms of you go to a hospital and then you'll be paying maybe for such services. So can you tell us about the stigma and how you overcame that?
Okay, thank you so much. First of the stigma is I also came as a student, so I was doing my postgrad at Flinders and in psychology, because the funny thing is I've also done psychology. And the reason why I did psychology was because back at home I was in ESIU, and the reason why I did psychology was like, let me do this and maybe it's gonna try and help me, because I don't like the person I am when I'm sick like that, like really bad. But clearly I don't think it helped. Anyway, so when I came here, what happened was, and that's what I'm gonna try and tell people, as much as we're all saying, oh, you need to go and get help as a student and all that stuff. With a student, unfortunately, you still have to pay so much. I think to see a psychologist, you pay over $180 per session to see a doctor. That's really bad, you know? That's really bad. And even now, I've got I'm a citizen, and if I want to see a doctor, like immediately, I'll be told, oh, you need to pay for a psychologist, you need to pay around 200 and something. If not, you have to wait. Like for me, I go to the Northern Mental at Modbury. So, and there I have to wait until I see a doctor, and then after that now I start seeing them. And if it's a psychiatrist, I have to see a psychiatrist after like 10 weeks and all that stuff. So you can imagine, and I'm here not paying anything for a student. It's actually really hard, you know, and it's so much money to pay, and no one is going to afford to pay almost $200 to go, and that's for one session, you know. So what was the question again? I forgot. As women, we talk too much. What was the question again? How
was the stigma around it when you actually?
So for my stigma, what happened? As I said, I came with it here, but I had a few stigmas because I've got a few relatives here, and some of the relatives actually did not help me when I needed help. Most of my help I got it from strangers and people who didn't really know me. My mom I'm used to being sick and all that stuff, the prenatal and postnatal and all that stuff. And the last time, the trigger that came after my mom had left, when she had come, my friends organized for her to come back because it was that bad. And we had a little baby. My husband had 3 kids to take care of. It was very hard. So I noticed even an own, you know, like your own relative telling mom, don't even come on the phone, don't even come, you know, we're tired of her, we're used to helping her, don't do this and this. That's part of the stigma and stuff like that. And some people don't see it. They're like, oh, but you have like a beautiful husband, I don't understand why you're very ungrateful. People don't understand it. And you tell them it's not even about that. It's about you yourself, you know. I'm the one who's sick and I'm the one who's going through, oh, you have beautiful kids, they don't even cry at night. And I'm like, it's not about that. So that was, those were the challenges, and there's still the challenges even now. People don't think you're real. People think you want attention. People think, nah, it can't be, it's not like this. Look at you, you went, you did all your makeup and everything, you look good. What's the big deal? What's the big deal? Why are you doing this? But they're not getting, you're doing this, but you're hiding so much. After this, you guys don't know. I might go home and I cry, you know? And I say, honey, what was I doing and all this stuff? But people don't understand that. And that's those are it's not easy. It's really hard. Yeah.
Yeah. Thank you so much for that.
Thanks.
So as you have heard, the stigma around mental health is really out there. People are not willing to listen. We should be kind always, listen, never judge. And that's the only way we can be there for them when they literally need us the most. And from our online viewers, we have Trifena Jael, who is asking, in what ways are community members perpetuating the fear of those suffering from mental health, making them want to hide their condition? What's out there in the community that makes you or someone suffering from mental health want to hide it more? Another thing, how can we perhaps be sensitive and be safe place so that people can be confident to talk about? And
I think one of the people online did say that create an awareness day. That would really be good. Yeah. An awareness day will sort of gather people, and people begin to openly talk about it, and eventually everyone will get to know that, look, we are all on the spectrum here. It could be someone else today, it could be me tomorrow, it could be another person, you know. It's just that as the stresses come, that's how it goes. So I think an awareness day would be really good. The other thing I want to talk about is the cost of healthcare. Especially for international students, they can't afford to see a psychologist if it's not part of their package, the health insurance package. It is too expensive. So what happens is they would need to look out for GPs who take just their medical insurance, because some practices will take just what the insurance will pay and see the client without the client having to pay a gap. So the communities need to be able to suss out GPs who do that or practices who do that. Because the reason why I cannot send one of my students to a psychologist, because they can't afford it. So I end up counseling them myself over time. And that is where if someone wants to see a GP, they need to, if they have mental health issues, they need to know whether the GP has interest in mental health. So that is an essential part. And whether the GP just takes what the insurance will pay or whether there is a gap payment. So that is one way we help our international students, because we don't take anything extra from them. We just take what the insurance pays, and that's it. Because we understand where they're coming from. And it's
maybe you can tell them where you practice, so that
yeah. Well, I mean, there are quite a number of us around as well. Yeah. So all I'm trying to say is there are little ways of getting around the problem of cost. Because there could be times where we even see people and we don't charge them anything, because I know where they're coming from. And most doctors are quite open if they get to know your circumstances. I mean, it's not always that a doctor would charge you an arm and a leg, okay? But we do even render some of those services for free. I'll just say, I have a fair bit of interest in obstetrics as well. So I do see a lot of pregnant women and deliver baby, who sort of we look after. And what happens is someone comes from overseas as a couple. They don't have the insurance as yet. But then they are pregnant and probably going to have a baby. Where is the money going to come from? You know, if they land in my practice, sometimes what I do is I don't charge them anything until the insurance kicks in, because I know where they're coming from. So what I'm trying to say is, when a general practitioner, that is why I'm saying a GP is a very resourceful person to be able to get around quite a number of the problems. If you ring a psychologist's room straight away, as you said, they'll tell you you have to pay $200 and you get nothing back. That is quite apart from your insurance. But if you start with your general practitioner, who would take time to get to know your circumstances, sometimes the GP is able to waive your fee because we are there to sort of help people, not just make money. Yeah. So I've had patients who have seen me for 3, 4, 5 months, not paid anything. When the insurance kicks in, then we get the payment for that. But until then, hey, I'm from overseas. I know what it is like to resettle.
Yeah.
It's not easy. But then it's one way of we can help to sort of ease the burden for a person who has mental health illness, you know. Yeah, so the important thing is when you're making an appointment with a GP, I'm stressing the GP because it is a good gateway. And if the GP, if you're making an appointment, you ring and ask, does he charge a gap? Does he take only the insurance? Am I going to pay a difference? And all that. Because then you walk in knowing that you walk in and walk out without having to think about extra cost. Yeah. And there are many GPs who do that.
Yeah.
Yeah. So
Thank
it's a
you.
matter
At
of
least
making
we have
sure.
you here, and I can tell you will have many customers after this. And there's some specific questions for you that time.
Yeah.
Someone called Cleophas Keegan. Thank you. You're watching Cleophas, and thank you for your question.
Mhm.
Now, Cleophas says, how does a typical appointment with you look like, especially we from CALD backgrounds? And what is the general time frame in which most patients will see results?
Okay.
And I will just couple that with a few others. Someone is asking, maybe this you can throw to someone else, how can I know that I'm suffering from mental health, yet I think I'm okay? And someone else is saying, Dr. Latte, are your books still opened? There's someone else saying, well, I think if I say too much, then we may not be able to go back there. But are you able to answer Cleophas, especially, who is asking those questions about you specifically?
Well, an appointment with a doctor starts with you making a phone call. And when you make the phone call, you say, I want to see the doctor. Of course, the receptionist will be the one who will take the phone call. And mostly what happens is we have time frames for appointments. We have short appointments, which will be up to about 5 minutes. We have standard appointments, which last for 20 minutes. And we have long appointments, which last for 30 minutes. And we have very long or extra long appointments, which is 45 minutes. So when you're going to see the GP, it's important that you state how the length of time you need. Yeah. Give a rough idea. If you have a list of things to see the GP with, like I have a headache, my foot is sore, my back is sore, and I'm feeling tired, and I think I'm depressed. That is enough for a 30-minute consult, especially if the doctor doesn't know you and the doctor is seeing you for the first time. The doctor would want time to be able to deal with all these for you. And again, it will not be one visit, because once you start seeing the doctor, he has to get to know you, and it takes a few visits to get the whole story. But so that you are not rushed and the doctor is also not stressed with time, it is good to make a long appointment. Usually I recommend a long appointment, a half-an-hour appointment for every first visit, because that way the doctor gets to know a fair bit about you and puts a plan in place to help you. Yeah, so that is what I would say. And please, when you are seeing the doctor, arrive on time. Yeah, please arrive on time, not African time, because everybody is allocated sometime. So if your appointment is 9 o'clock and you get there at 9:20, you only have, and you have a half-an-hour appointment, you only have 10 minutes, and you might not be happy, but the doctor has a waiting room of people who have turned up on time. So with that, I would plead with our people that you sort of be punctual, and also most practices are not walk-in practices, because what we realize is, Africans as brothers, someone will just walk in and it's like, okay, I was just passing by and I have this problem and I just want to see the doctor. It doesn't work like that, because that puts a lot of pressure on the doctor's day and time. So ring and make an appointment. And when you are coming, one good thing you can do is just list the things you have on your mind. It makes it easier for the doctor to work through, rather than finishing talking about what is happening back home, and then it's 1 minute and you say, by the way, you know, I've had a chest pain the last 2 days. That throws everything out of gear. So make a good list of things that you want to talk about. So when you walk in, the consultation is very smooth.
Thank you so
I hope
much.
I've answered that question.
Oh, very well indeed. Very well indeed. And I don't know whether we're going to have time to go through everyone that is chipping in online. We have so many people who are chipping in online. Now, as our guest gets a drink or so, let's go just for a commercial break, and then we'll come back and wind it up. It's quite late now, and we are coming to you live from Adelaide City. Sorry for the background noise. We are at the heart of the city. There's some background noise from the cars and everything around us, so bear with us for that. And we go for a commercial break. We're going to bring to you certified homes, and watch this video. If you are looking to invest in Kenya, certified home is one of a trusted developer. Watch this video. Thank you.
Thank you very much. Anytime we go out there, we've got something new for you. Because this time round, wanasemanga na nyuki mwisho wa reli, lakini sisi tunasema na nyuki mwanzo wa maendeleo, because we have got some good news for you. This time round, I'm introducing to you Favorite Gardens Nanyuki, a place that is known for serenity, a very cool place that is maybe favorable for cottage hotels, you know, retirement homes. You can do your personal private homes there, or even do farming. And they are going only for 150,000 Kenyan shillings. And what you need to do is just to talk to us. Every Wednesday and Saturday, we take you for site visit, absolutely free, no charges. Just grab this opportunity, because this place is very prime, and this introductory offer may not last forever. What we say is hurry when they last. Come talk to us on 0711 128 128.
Thank you for watching that video. If you are looking to invest in certified homes. As we wrap it up, where we have heard from Dr. Latte, from Diane, Judy, you know, there's so many people here talking about how we can access support. Maybe Tracy can read some of this, especially the one from Baraka. Tracy can read for us some of this information from online.
Can't we agree more? This should be a takeaway and immediate action to point for the leadership, like to have that organization or that group, that community group that can actually be readily available, that any person can actually come to and talk to.
Absolutely, I think that is a fantastic idea. I think from what Dr. Latte has said, we have a lot of resources within ourselves. And I think when we begin to look into our community, we can actually see that we can actually tap into the resources that we have. As I said earlier, some of the supports that are available are for you to link yourself up with somebody with a lived experience, because that person has actually walked the journey. They have walked the journey of mental health in Australia. When they started to struggle and they actually spoke up, what sort of support did they get? So if you're that person who's starting to struggle, you can look into that person and they can actually walk with you. And they can tell you, this was my experience, this is where I went, this is a doctor who supported me, this is a person, this is where I got the help from. So that is one way of actually getting that lived experience peer support from within our community. And again, as Dr. Latte said, we might have those people who are trusted within ourselves that we would like to talk to. Because as we all know, people from CAL communities are very fearful of seeking government support.
Can you explain what CAL means?
So the CAL stands for culturally and linguistically diverse backgrounds. People who are from other backgrounds that are not mainstream Australian. And so this will include, you know, African community, the Chinese community, you know, the Vietnamese community, and many other communities that actually have come here to Australia and not probably born here. So, so with these communities, we are known to fear or to have a fear of getting support from government, maybe because of previous experiences from where we come from. As we know where we come from, when we see a police officer, we run away because we know that we're in trouble. So we need to start looking at accessing and connecting to services from a different perspective, because in Australia these services are available. There is no prosecution if you access them, and you can actually benefit when you access the service. Yeah.
Thank you so much. And go back to Anne Flora. Do you think if we had a community group that was dealing with such mental health issues, or a community group that was there and readily available for you, do you think it would have actually made an impact in your life?
Oh, definitely it would. It would, if here, you had that and you felt, oh, there's someone there, there are people there who are here for me and all that stuff. Definitely that would make a very big contribution, and a very big, because most people who I used to even be with, they'd be like, oh, I didn't know you used to suffer from this and all this, And then you meet other people, like even now, I even know right now, I know someone who's at Woodley, but they cannot talk about it to other people, and it's really sad. And I'm like, can I tell other people, no, don't do this? They're at Woodley being admitted there. So I think, yes, if there was that kind of whatever that was there, that would really help, and so much, especially because even the person that I'm talking to, the one at Woodley House, is a very young person. This is like a 20-year-old. I'm 37. This is a 20-year-old, but he's so ashamed to do that, because he's like, what will my friends say? What do they do this? And it is sad. It's really sad. Yeah. So definitely, yeah. I wish there was a group, or there was something about other people, because some people also come, as you guys were talking about it, there's some people who come from Kenya, like how I did from when I was 12. People who come in, they have their issues, So if there was like that support group and people went, it would be really good. Yeah,
thank you so much, Anne Flora.
Thank you.
Now, I don't know what you're going to do. Time is really much gone. It's 10 p.m. here in Adelaide.
Yes.
Well, Trufena is saying, panelists, how would you advise a Christian who would rather just pray about things when they are clearly in the red zone? We Kenyans are very religious, and we sort of expect pastors to handle, we expect pastors to handle all our life challenges, including mental health. How can pastors who hear all our manenos support us to seek medical support for mental health issues? Dan, do you want to talk on that?
That's a big one, actually.
Yeah, it is.
I was like, wow.
It is done.
Yeah, I don't even know how to begin to dissect this. But I feel like, praying, I feel is definitely a way to release as well. Even though it may be personal, just between you and God, I feel like it's definitely a way to empower yourself and to help you through a bad time. But I feel as though it's okay as well to seek additional help from somebody else, because that is so personal. It's like you almost it almost just stays here. But sometimes I think there's just a lot of power sometimes in actually speaking to somebody else face to face, looking you in the eye. You know what I mean? It's like a process of venting, really. But I feel like there's a lot of power in that. Not to say that there isn't just as much power in also praying. So I feel like it would be good to balance it. But that's my view. But that's a big question. I'd love to hear from you guys as well.
No, I'll just quickly say before doctors talks about it. The thing is, what people don't understand with mental issues, sometimes it's more of, there's a chemical reaction and imbalance and all that stuff. It's not about I'll go there, pray for you and all that stuff. That comes, okay. It's not like a psychosocial kind of thing. It's more of chemical. Like I know for me, if I don't take my meds and all that stuff, I know what normally happens. So like my husband has his alarm. My older son has got his own alarm, to tell mommy you have to take your meds, and that's what happens. So I don't. it's okay. Yes, we are all prayerful. We are all this, but it comes to a time. It's not even about the praying and all that stuff. It's about something else, and doctor can.
Yeah.
Well, what I would say is definitely prayer has its role. The pastor has his role. I mean, why did God put pastors there and doctors there and all that?
That's right.
So we all have our role to play in this. And as has been said, you know, depression can be a chemical imbalance. Yeah. And I believe prayer is part of helping yourself to talk or let out your issues. But again, when it comes to your pastor, if your pastor is a trusted person who will not let your issues out, that is a good avenue to take. And I know many pastors would direct you back to your doctor as well. Because when it comes to mental health, it's a team effort. Yeah. It's a team effort. We need the support from all aspects for the person. You know, we need the family to be on board. We need your community members to be on board. We need your friend to be on board. We need your church, if you are a church goer, to be on board. We need the social group to be there. Your doctor needs to be in the mix. So it's a team work, you know. And as I said, even the GP alone cannot handle it.
And then to doctor, let's say if someone comes to you, they're suffering from a mental health condition, they have depression, and they have seek medical advice, and they have started just the way if you had a cold, they will tell you within like 2 weeks, you start feeling better, and if you don't, please come back. What is the recovery for mental health issues?
Okay. So mental health issues take time. And usually by the time the person comes to the doctor, they're probably in the yellow, or not in the yellow zone, mostly in the red or black zone. So it means issues have piled up over time. And what happens is, usually if we really eliminate physical health issues and we are sure that this is a mental health issue, we zoom in on it, and it's going to take probably 3 to 6 months of a few visits to work at things. Usually we start with, if the one walks in a crisis, we want to handle the crisis first, because that is what leads people to harm themselves. So we tackle the crisis issues first, and sort of allay anxiety, and sort of let the one know that, look, you are going to be okay. It will take time, but just stick with me and stick with the plan, we'll be fine. So usually once we arrive at the diagnosis, the first thing we want to do is have a treatment plan, which includes either the GP himself counseling you, or getting a psychologist on board to counsel you. And that usually will take about 10 to 20 visits to work through issues, because these are life issues. You know, you're working through life issues, past stresses, past traumas, injuries, and things that you've bottled up over time, and it needs to be unpacked. First, we need to unpack it to know exactly what it is, and then we start tackling them bit by bit. And in most cases, it will involve counseling, which delves much into your mind space. We want to ensure that you are thinking properly, or we challenge your thoughts. You know, if you say, you know, I'm good for nothing, what do you mean you're good for nothing? You know, here you are, we challenge the thoughts, because the way you think affects the way you feel, and the way you feel affects the way you act. So there are various ways we go about it. We challenge the thoughts. We challenge the action, the feeling, and the action. We also challenge you in terms of saying, look, there are things you can change, there are things you cannot change. You need to know the difference clearly and focus on things that we can change and improve on. So that's what we call it ACT, which is acceptance cognitive therapy. Then mindfulness, live in the now. Okay, like we are here, we are safe. There's no bomb going off here. There's nothing happening. I'm safe. I'm okay. You know, rather than thinking about tomorrow, the next day, and all that. So we sort of de-escalate the thought process as much as possible. Sometimes we add medication, and there are various medications we use depending on what the situation is here. In addition to that, we encourage people to exercise. Physical activity releases endorphins in the body that helps with depression. I know people who say, look, I don't want to do anything, I don't feel like going anywhere, I just don't want to talk to anybody. But after they've challenged their own thoughts to say, look, I don't feel like doing it, but do it anyway, I'll do it anyway. I tell people, look, go for a walk. Whilst going for the walk, just say, doctor asked me to go for a walk, I don't want to do this. You can curse me and all that, but just go for the walk. They feel better for it after that. So long and short is, it takes time. 3 to 6 months with several visits, regular visits. Initially, frequent visits. As time goes on and things are looking better, we spread it out a bit. That way, we just make sure we remain in touch and work through things.
Thank you so much, Dr. Latte. And indeed, mental health treatment it needs a lot of discipline. And even as Anne can concur with us, you have to be very disciplined. Otherwise, it might roll back all the benefits that you have gained. So if you have been advised by the way, what does a psychologist and a psychiatrist, what's the difference?
Okay, a psychologist does not prescribe medication. A psychologist works on the behavior, change of behavior, cognitive behavior, attitudes here, to challenge your thoughts, talk to you about issues, help you to see from different perspectives, try a few other things.
Yes.
Here, a psychiatrist usually looks at if the diagnosis is not clear and the GP is not able to sort of put a finger on the diagnosis, it gets to a psychiatrist. And when there's the need for medication and medication is not working well, then the psychiatrist comes in. So the psychiatrist is a doctor who is on top of all mental health issues.
Thank you so much for that elaboration. Now, I'm so sad that we cannot end this discussion. And that call for us, maybe we will come back again to this show. There are so many people who are responding online. I can see so many people here, they're saying we must not forget Esther Arunga's story. I don't know whether you are familiar with that story. It ended up in tragic circumstances. And that is what mental health can lead to, tragic circumstances. If you, like I said when we began, if you're not sharing it, you are carrying it. And when you carry it, it's dangerous. So you'd rather share. And as we say, sharing is caring. And our problems shared is half solved. So please share. It's okay. It's okay not to be okay. And we have examples of people like Anne here, who you have listened to tonight. It's okay not to be okay. Now, Diaspora TV Australia will continue this conversation. This is Baraza. Baraza is an initiative of Kenyan Association of South Australia. And we are going to make sure that we come up with a good partner every time. And we have to handle this issue. We have to handle this elephant in the room, mental health. Because each and every one of us, it's just the degree that matters. But we have little bits of issues, mental health issues. And the coping mechanisms, that's what matters. So many people are saying that our panelists, you've done a good job, and it's a great topic, and therefore this public debate, which is good. And as we said when we started, it's good not it's okay not to be okay. I just want to read a few statements here. Just know it's okay not to be okay. Never feel ashamed of your feelings. Practice self-care. Take a break when needed. Like now it's school holidays. Go for a holiday. Go interstates. Remember, you are not alone, and you don't owe anyone an apology for your feelings. You don't even owe anyone an apology for coming out. Don't listen to people peer pressure. You don't owe anyone an apology. So thank you so much, our panelists. If our cameraman can zoom into our panelists, thank you so much, Tracy, for being our host today. Done a good job, and thank you so much, Diane Calais. If you can wave to our viewers. Yeah, thank you so much, Dr. Latte. Now, Dr. Latte comes from Ghana, and we are so grateful to have him tonight. Thank you so much for gracing our show tonight, and your input was very, very, very good.
It's a pleasure. Just before you go on, I would just want to add a crisis line number. Usually when we discuss mental health issues, it can bring about crisis in some people. So there are 2 numbers that I'll give out there now. If anyone is in crisis, if you ring that number, you'll be helped. The first number is for the crisis intervention number, which is a 13-14-65 number. If you're in crisis, you dial that number, someone will help you. The other one is Lifeline, which is 13-11-14. So those numbers are available, and you just dial the number, and there'll be somebody on the other side of the line to talk to, and it's great to be here. Thank you.
Thank you. The crisis number, do you ring if you're even in a domestic crisis?
Any crisis.
Any crisis.
Any crisis.
Thank you for clarifying.
Any crisis.
Any crisis.
Yeah.
Financial crisis?
Well, any crisis. Any crisis.
Yeah, and those of you who had seen our slide there, we had shown a slide there of help that is available in Australia. We have family and friends, counselors, Lifeline, like has been said. If you're a man, we have Beyond Blue. Their number is 13002243636. There's Headspace. Their number is 1-800-650-890. And if you're in immediate danger, just ring 000 if you're in Australia. It's so sad that in most of our African countries, we don't have this rapid response. Now, as we continue to wrap it up, thank you so much, Judy, for coming. Judy Abioro gave us a lot of information on how we can access NDS supports. Thank you so much, Anne Flora. Your testimony touched many. And they have really applauded you online for coming out.
Thank you.
Yeah, you are such an inspiration. And then we have our Options Education Director for Australia, Dennis Maria. Thank you so much for being on the show. God bless you. Now, God bless you all. Good night in Adelaide. Good night, everyone.
Bye-bye.
Good night. Bye-bye. I will leave you with this video from AMG Realtors as we wrap it up. Just watch that video. If you want to invest in Kenya, AMG Realtors is one of the developer of choice. Thank you so much, and good night in Australia. Have a good afternoon in Kenya.